transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time, but this is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard and doing some job. Medical protective gear must be reserved for the frontline healthcare workers who are performing those vital services.
A little bit more on the advice on face mask. What would people gain from wearing a mask, and why are you opposed to wearing one yourself?
Well, I just don't want to wear one myself. It's a recommendation. They recommend it. I'm feeling good. I just don't want to be doing, I don't know, somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass, and hopefully it'll pass very quickly. Now, with that being said, if somebody wants to, I mean, most people can just make something out of a certain material, so it's very well designated. It's very simple to do. I won't be doing it personally. It's a recommendation, okay? And would you like to say something about that?
Sure, absolutely.
Surgeon General, please.
Well, thank you, Mr. President, Mr. Vice President, Mr. Secretary, and CDC Director Redfield. I especially want to thank the folks at the CDC, and it's a great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies.